Hello friends, today we are going to discuss about one more important topic from the clinical examination of motor system. Previously we have discussed about muscle power, muscle tone. Today we are going to discuss about the important topic, that is muscular wasting. If we consider or if we think of our routine methods of examination of any particular system, we know that there are 4 different steps in the examination of any system, that is inspection, palpation, percussion and auscultation. When it comes to the examination of the motor system, these 2 points that we have already discussed, muscle power and muscle tone, it falls under the palpation activity. You need to palpate a particular muscle or to palpate a particular group of muscle to assess these things. But when it comes to the muscular wasting, you need to do the inspection of the patient. So even though I am making this 3rd video in the clinical examination of my motor system, this will be the 3rd video. Always take the opportunity to see or to rule out presence or absence of muscular wasting before you do muscle power examination or muscle tone examination. So before you start palpating the person or the patient in your OPD, always take the opportunity to see for the general condition of the muscle that you are supposed to examine. Why? Because to rule out presence or absence of atrophy of the muscle or hypertrophy of the muscle. So muscular wasting is nothing but the atrophy of the muscle. The muscles becomes atrophied. The person will be lean, thin and emaciated. So if suppose you are sitting in your OPD and a patient visits to your chamber, and on the general examination you find out that his limbs are very lean, thin, the person is emaciated, maybe he is having or he may be suffering from muscular wasting. So if suppose this is a situation, if the person is having muscular wasting, you have to see for whether this wasting or whether this atrophy is generalized or localized. So muscular wasting should be seen for or should be differentiated into generalized muscular wasting and localized muscular wasting. Now what is the meaning of generalized muscular wasting? All the muscles of the body will be atrophied. The limb muscles, the muscles of chest, the muscles of hip girdle, all the muscles will undergo atrophy, and that is why the bony parts will become prominent. Say for example, if the chest muscles are atrophied, if they are wasted, the clavicle, the ribs will become prominent. If the hip girdle muscles are wasted, then the anterior superior iliac spine will become prominent. So likewise you have to see for or you have to rule out generalized muscular wasting with localized muscular wasting. If suppose you come across with generalized muscular wasting, what are the common causes for generalized muscular wasting? The most important cause is malnourishment. In one of the diseases like protein energy malnourishment, you know about marasmus. The children who is having marasmus have generalized muscle wasting. Even the buccal fats, the muscles of the facial region also becomes wasted. They becomes atrophied. Apart from this protein energy malnutrition, what is the another cause for generalized muscle wasting? It is malignancy. Any malignancy can result into generalized muscular wasting. What is the another cause? Tuberculosis. In cases of tuberculosis also you will notice generalized muscular wasting. When it comes to the localized muscular wasting, you have to compare the one limb to the another limb. Say for example, you are examining the right hand of the person. You have to compare the muscle with left hand also. And then you have to see whether the muscles are atrophied or not. What are the common causes for localized muscular wasting? Any injury to the bone, any injury to the joint, or any injury to the muscle itself will result into disuse of that particular muscle. will result into atrophy, and that will be termed as disused atrophy. So here we have discussed about the generalized and localized causes for muscle wasting, muscular atrophy. Once you have ruled out the muscular atrophy, you need to see for presence or absence of hypertrophy also. We know that hypertrophy usually occurs physiologically. When the muscles are overused, the bulk of the muscle forms, the muscle becomes hypertrophied. But there are certain pathological conditions are present in which even though the muscles are disused, even though there is very less use of that particular muscle is there, but still the muscle becomes hypertrophied. So the exception for the disused atrophy is Duchenne muscular dystrophy. In short, it is termed as DMD. It is a genetic disorder, Duchenne muscular dystrophy. What happens in this disease? Even though the person is not using that particular group of muscle, on examination the muscle will appear hypertrophied. But when we compare when we see for the presence or absence of power, weakness in that muscle, we will find out that the power or the weakness is more as compared to the mass of the muscle. So that is what is about muscular wasting. So you have to rule out muscular wasting, presence or absence of muscular wasting, then you have to see for muscle power followed by muscle tone. In the next video, we are going to explain about another important clinical topic, involuntary movements and different types of involuntary movements. Thank you.